We are all in this together. You've heard this quote, I'm sure, many times in the last couple of weeks. We are all in this together, and this is referring to the coronavirus pandemic. You've heard this phrase uttered by politicians, by media figures, by religious figures.
Now it's our time. We must sacrifice together because we are all in this together.
And in theory, it's true. We are all in this together. But we also have to ask ourselves in a more critical manner, does the coronavirus actually discriminate? Does it actually impact some individuals living in American society over others? Experts have noted that the burden of COVID-19 will not be shared equally among Americans. Experts are pointing to social factors like income level, race, and immigration status as the main factors which make this infection hit some people more than others. The Center for Diseases and Control, the CDC, has repeatedly found over the years that even something like the seasonal flu will hit people in high poverty areas more so than in low poverty areas. Think about the following scenario for a minute. Imagine an employee, they feel pressured to go to work when they're sick because they are worried that they're not going to get a paycheck. And in doing so, they increase the risk that they'll not only be infected, but they'll also infect their coworkers. And by doing so, they're neglecting their own health. So individuals in low-paying jobs and jobs that do not have as much security as other jobs, individuals who hold these occupations are faced with an extremely difficult scenario. Go to work and get paid and perhaps get the coronavirus, or stay at home, not get paid, and face the fallout of this decision. When unexpected emergencies do occur, an individual or a family's wealth can provide them with protection. Wealth, especially liquid wealth, which are resources that can be readily converted into cash, allows individuals and families to respond to life events and unexpected expenses, such as loss of income and virtually any expenses that may result from a pandemic. Unfortunately and unjustly, we know that wealth has been unequally distributed in American society. The typical white family has 10 times the wealth of the typical black family and 7 times the wealth of a typical Latinx family. This stark racial wealth gap leaves members of the black and Latinx population and other low asset populations in this country without income. And black and Latinx households have fewer resources in case of an emergency, such as the coronavirus pandemic. It's also important to note that these communities lack wealth not because of individual choices, but instead due to 400 years of collective harms by federal, state, and local governments compounding over time. And what about social distancing? Does social distancing harm certain individuals in certain populations in the United States? An article by Danielle Soliman on American Progress provides some insight. While social distancing is obviously a smart public health policy, the ripple effect of social distancing will be particularly detrimental for Black and Latinx communities, especially if governments don't take action to minimize direct impacts on the pocketbooks of Americans. This is where the economic security that wealth provides comes in. Wealth is one's assets minus their debts. Black and Latinx communities are less likely to own assets. For example, almost 30% of black college-educated households and 20% of Latinx college-educated households would not be able to afford to pay all their bills after a $400 emergency expense. These figures increased to nearly 60% and 50% respectively for non-college educated black and Latinx households. With little to no liquid wealth and vulnerable job prospects, Black and Latinx families are more likely to face greater housing insecurity, including exposure to eviction and foreclosure, which in turn will exacerbate the racial homeownership gap. Furthermore, both Black and Latinx employees are paid lower wages than their similarly situated white counterparts. For example, Black, Asian, and Latinx workers are overrepresented in the restaurant and hotel industries. And we know, if you just simply follow the news, that these are the two industries that have perhaps been most impacted by the quarantining and the self-isolation demands imposed upon us by local, state, and indeed our national government. So, does the coronavirus discriminate? Perhaps it does. We've been told that we're all in this together. Indeed, this is true to a certain extent, but we also need to remember that certain populations, certain communities, and certain neighborhoods will be impacted by this pandemic in a different way. So, some questions for you to consider. A national challenge like the coronavirus outbreak reminds us of the structural issues that disproportionately impact some populations in the U.S. more than others. What recommendations do you propose in terms of policy changes that could alleviate the suffering of our fellow human beings during this time of crisis? Should members of some population, based on race, ethnicity, class, etc., receive more financial assistance than others? Furthermore, is the kind of assistance offered by the federal government not just like putting a Band-Aid on a wound that needs surgery? Is it not like putting a Band-Aid on a wound that needs surgery? Is the federal relief offered by the government enough? Is it really a step in the right direction? These are some questions for you to think about. Please leave your comments below, and I'm looking forward to hearing from you. Thank you.